Hello, I'm Alistair McClellan, I'm the editor of HSJ. We launched the Modernising Healthcare Summit last year for one reason. We felt the NHS wasn't having the debate around technology it needed to have. Let me try and explain why. On one hand, you had a whole group of technology evangelists turning up at IT events, talking to each other about how the world could be so much different if people only listened to them. On the other side of the equation, you had people running NHS organisations at trust board level and CCG leadership level, in which the challenges they faced day to day felt very, very different from the ones that were being discussed at those technology conferences. And then you had the system managers, the regulators, NHS England, who knew that technology was an important part of what they wanted to achieve, the delivery of the 5-year forward view, but were finding it hard to get a conversation going in the right way. Now, what we wanted to do with Modernising Healthcare was to bring those three communities together for the first time, so that the technology evangelists could explain what they really thought technology, the benefits technology could bring, but those running NHS organisations could really quiz them about how they would actually address the day-to-day challenges they face around service performance and efficiency and financial sustainability. And both groups could talk to those system managers, those regulators, NHS England, people from the Department of Health, and hold them accountable for creating a system in which the right choices around technology could be made. HSJ summits are not your normal conference. They're conversations between senior healthcare leaders that are there by invitation only. Yes, we have people giving keynote addresses and serving on panels, but anybody who comes to a summit could be a keynote speaker or could be a panelist. The great majority of the time we devote to debate, to addressing the problems that they're facing the NHS and to trying to resolve the solutions. And because it happens under Chatham House rules, we're able to get really to the nub of the issue, deal with the nitty-gritty issues and find a way forward. Well, as I've explained, what we really wanted to do in the first Modernising Healthcare Summit is get this debate out on the table because it wasn't happening anywhere. And I think the highlights of last year's event were precisely when that happened. So when Lord Carter came and gave the opening keynote address and talked about the role that technology would play in delivering the efficiency goals that he was going to be setting out as a report. And senior healthcare leaders in the room were able to challenge him on those issues, and a really strong debate developed from that. So right from the start, we were getting what we wanted, which was an honest debate around technology between all of the people who were involved in investment and adoption decisions. Personally, one of the other highlights for me was a presentation we had from Sir David Dalton, Chief Executive of Salford Royal. Now, David is famous for many things, but one of the things he's particularly keen on at the moment is the development of the enterprise model, which sees organisations joining a club to share intellectual property around developments, new care developments, new organisational developments. And technology is a very, very big part of that vision. And he explained how the electronic health record would be the sort of controlling intelligence of the organisation that he was trying to build. Now, David will be the first person to say that he has many, many issues to work out in realising that vision. But to me, it was the most cogent and the most persuasive way that the NHS is going to make this great leap forward in technology. And I found it a particularly thrilling session. I think the focus of Modernising Healthcare 2016 will be money. Now, this will not surprise anyone. Everyone knows that the focus of the coming financial year will be returning the NHS provider sector to the black. But technology is going to play a very significant role in doing so. There is a lot of new money available in 2016-17. Of the £4 billion extra money that Simon Stevens won from the Treasury last November, the great majority of it comes in the current financial year. That money is going to be allied to the development of strategic transformation plans that all regions are producing. And a significant amount of that money, £400 million, will be tied to the use of technology. So we will be debating at Modernising Healthcare 2016 how that £400 million is going to be divided up, and basically how leaders can put their plans together so that they get their fair share of that cash. At the first Modernising Healthcare Summit, we explored why the investment in and the adoption of new technology was important. This year we're going to be exploring the nitty-gritty of that challenge. We know, for example, that the Care Quality Commission are going to be holding organisations to account for their new technology. We know, for example, that meaningful use clauses are going to be added into NHS contracts with technology suppliers, so you pay for effectively the benefit you get from a service, not from a piece of kit or a service. And we know that trust boards are going to be held accountable by NHS Improvement for technology adoption, particularly in relation to the development of their strategic transformation plans. Those are the issues that we are going to be addressing with the most senior people in the service, the people who are directly responsible for developing and implementing those policies, and of course delivering care.